Griffin, your local 5-star law firm. Count on Local 3 News for more local stories.
We're going to talk about hearing loss this morning with our good friend Dr. Tiffany Ahlberg at Ahlberg Audiology. And as you know, if you watch the show on a regular basis, there is really no shortage of conversations that we can have about hearing loss can impact your life and what you should know to treat it or perhaps even prevent it. So she's back this morning talking about something I don't think we've really discussed in depth before, and that's single-sided deafness. That makes sense.
You'll see it listed as like SSD, and that's where someone has a almost total hearing loss or very severe to profound hearing loss on one side, and either just a partial hearing loss on the other, or sometimes normal hearing on the other side.
Is that sometimes the result of an injury or something?
It can be the result of an injury. It can be a result of something we've talked about before, where someone has a sudden sensory neural hearing loss, where they just lose their hearing and it goes down. It can be a result of medical treatments that maybe cause something on one side. Sometimes we just don't know. It can be a viral attack on one side. So there's so many different causes, and sometimes there's just no answers as to why somebody has a hearing loss on one side versus the other, which kind of leads me into we have to send people for a medical evaluation to make sure that it's not something that we're seriously worried about before we just do treatment on something like that. But
okay, so onto the sudden hearing loss, just to kind of gloss over this again, if you ever have a sudden hearing loss, it really is important to get pretty quickly to an audiologist.
Very quickly, yes.
Because two reasons. One, you just would want to, and the other is that if there's a certain time window there, it can possibly be corrected. Is that right?
Yes. We want to evaluate and seek medical treatment within 24 to 48 hours.
And
after
you
that
can
happens.
facilitate them getting to the right person to get them in the door.
Yes.
So if you live with this single-sided deafness, I would think that would really affect your equilibrium, headaches, that kind of thing.
You're right, as far as the balance, it does give us balance, but also how people localize sound. We get that from getting the information from both ears, and our brain analyzes how long did it take to get to this ear versus how long it took to get to this ear. And so our localization is affected, how you hear in background noise when you only have one ear. You just have one ear hearing everything, so your hearing in background noise is affected. So lots of things are affected from that. Or just, there's something called a head shadow effect, and I always think of it as like having an apartment and having a noisy neighbor. So when things are loud enough, they can cross over to the other ear, but as you can imagine, it's muffled. So if your neighbor's talking, it's really loud, you can't hear everything that they say, and that's kind of how this ear feels. So if someone's talking on this side, but you don't have any hearing on this side, things will cross over, but not everything that you want for understanding. So one of the things that we do, one of the treatments that is available for single-sided deafness is something called a cross or a bicross. And so that is where someone wears a microphone on the dead or severely impacted side, and it crosses over to the other ear so that the effect of that head shadow effect doesn't take place. So the microphone picks it up, crosses it over to the good ear, and they hear. Okay,
so I'm a very literal person. So when you say this and then you do this, I'm envisioning like like earphones, but
it's wireless. It looks just like a hearing aid. It's just that one side is a microphone. Yes.
Got it. Okay. Now you said that's one of the treatments. What else would there be?
So there's something called a bone-anchored hearing aid, and this is for someone that has normal to near normal hearing on one side, and a dead ear on the other side. And it's something where a surgeon, it doesn't have to be surgically implanted, so there are options where people wear like a headband, but it's something where it takes the sound in, and bone conduction, I know we're getting into big words, but it's where the sound is magnified by the bone, and so the better cochlea or the better ear is actually hearing that sound. So we use bone anchored or just bone conduction hearing aids for several different issues, but single-sided deafness is one of them.
Okay, dumb question, but is that how our bodies work? Does the bone in our skull help to create much like the acoustics in a church or something?
you get the vibration, and it sends a signal straight to the cochlea. So there's an actual part of our diagnostic testing is where we do a bone conduction test. And so we put a little oscillator behind the ear, and it travels to the better cochlea. So that's how we, as audiologists, are able to tell if someone has a sensory neural hearing loss, which is the inner ear, versus a conductive hearing loss, which is the middle ear. So
okay, if you went with the bone one, if that's the route chosen, then does it work that thing that's attached, essentially implanted, if your hearing changes over time,
they're adjustable,
they're
just
adjustable.
like a hearing aid.
Okay.
And then another treatment
I'm gonna start taking notes. Okay.
is now cochlear implants are they have been cleared to be medically used for single-sided deafness as well. So that is just one more option out there for people who have hearing on one side and no hearing on the other.
If you have the single-sided deafness, like other types of hearing loss, can it progress over time? So what right now is kind of a nuisance, with time can it become a full-on deafness? Or is it pretty obvious that you've got
Yeah,
it?
so if we call it a single-sided deafness, if we're looking for this treatment options versus just a traditional hearing aid, that means that there is no usable hearing on that side.
Okay.
So yeah, it could get worse, but I don't know that it matters because it's almost gone anyway.
So somebody watching today would know if they have that or not.
Yeah, I mean, again, I've had because people come in the office and they're like, I need a hearing aid for this ear because I can't hear anything out of this ear. And you have to have usable hearing for a hearing aid to help you. So you can't just go put an amplifier in an ear. It's like putting glasses on an eye that's blind.
Gotcha.
So there are other treatment options available when no usable hearing. A hearing aid can't help you.
Well, okay, I did not know that's where we were going to go, so I'll take us in this direction then. That's why it's so important that you have an audiologist check your hearing. If you do these, color by numbers, order a hearing device over the counter, you don't know what you're getting.
Yeah, exactly. Yeah, it is very important to have a hearing test.
Okay, remind me again of how old you should be for that baseline hearing test.
So 50 is the age that we usually recommend everyone have a baseline hearing test by.
Okay, but if you're recognizing this morning that maybe this is me, or that there is just something funny about my hearing, make an appointment and find out.
Yep.
Right, because it happens in kids too.
Oh, yes. And a lot of times it's congenital. So you can be born with a hearing loss total on one side and good hearing on the other, and it affects everything.
Okay, and I will nag people on your behalf that before you get out and cut your grass this weekend, make sure you wear some ear protection. If you're going to a concert, wear ear protection. It's far more easy to damage your hearing than we really think.
Thank you, Julie.
Love talking to you, Tiffany. Tiffany Ahlberg at Ahlberg Audiology in Cleveland. You can easily make an appointment with her by calling the office, 641-0956, and see more about her at ahlbergaudiology.com. Thank you.
Thank you.
Right now at Ashley, get 0% interest for 6